Good evening. My name is Adriana Silva. I am a doctoral student in the Providence Sacred Heart Medical Center, Gonzaga University Nurse Anesthesia Program in Spokane, Washington, and also serve as student representative on the AANA Education Committee. I am honored to be moderating this town hall and so pleased to welcome my fellow SRNAs. We have representatives from the AANA, the COA, the NBCRNA with us this evening. Education, accreditation, and certification are the three legs of a stool that form the foundation for the nurse anesthesia profession. Strong legs are required to ensure a solid foundation for our profession now and for the future. I am pleased to introduce our panelists. With us today, we have Kate Jansky, our AANA president, Randy Moore, our AANA CEO, Adrian Chavez, the student representative on the Health and Wellness Committee, Reagan McCammon, the student representative on the Practice Committee, Emily Dong, student representative on the Government Relations Committee, Laura Bonanno, the COA president and program director of the Louisiana State University Health Sciences Center School of Nursing, Nurse Anesthesia Option, and John Preston, the NBCRNA Chief Credentialing Officer. First, AANA President Jansky is going to say a few words. Followed by her, we will have our CEO, Dr. Moore. Kate?
Good evening. I'd like to also welcome you all to the AANA SRNA Town Hall. On behalf of the AANA Board of Directors, I would like to thank you for tuning in. Student registered nurse anesthetists are vital members of our association, and our support for you is unwavering. This is an unprecedented time, and I'm proud of all the work that our members, both students and CRNAs, are doing to help address this healthcare crisis that we are facing. Many of you are assisting in this crisis as critical care nurses while juggling schoolwork, family, and trying to maintain your own well-being. We understand that our students have been uniquely affected. In the past few weeks, you've seen a lot of communication from the AANA about recent developments related to COVID-19. I can assure you that the AANA Board of Directors and staff are working diligently to bring students the resources that you need. The goal of tonight's call is to discuss with you some of the concerns that you have related to your educational programs, certification, advocacy, practice, health and wellness, and state government affairs. Thank you for submitting questions to guide our discussion. I'm pleased that most of our speakers tonight are student representatives from AANA committees. We are also joined by staff from the AANA, the National Board of Certification and Recertification of Nurse Anesthetists, and the president of the Council on Accreditation of Nurse Anesthesia Education Programs. I'll now turn this over to Dr. Moore. Dr. Moore?
Good evening, everybody. So, what I'm going to do is provide a high-level overview of what the association is doing, where we think things are going. We'll drill down in a little bit later in the town hall on some issues that are more specifically directed towards you. But I wanted to give you just a snapshot of where we think things are and where we think things are going to go. So let's talk about the current situation, and that we are now seeing more and more states, particularly in the Southeast, start to open up in some way. And we're going to see, undoubtedly, as a result of that, more and more elective procedures resume. Now, as you likely know, somewhere around 50% of the nurse anesthesia workforce has been adversely impacted by COVID-19, particularly around diminished work hours. So we know that many CRNAs are having their hours reduced. We know that many CRNAs are being furloughed. Now, the interesting dichotomy that is presented with that is, while about 50% of the workforce is underemployed or unemployed right now, the other 50% has been redeployed and working in critical care units all across the United States on COVID response teams and managing critically ill patients. So, I've been a nurse anesthetist since 2005. And I can safely say that I have never experienced anything remotely like this. This is hopefully once in a lifetime, once in a century-like situation that we hopefully won't have to experience again. But I will say, from what I'm seeing, is the disruption that's occurring in healthcare right now is profound and unprecedented. So I wanted you to know that the AANA is acutely aware of how you've been impacted, and we're working very closely with our colleagues at the NBCRNA and the COA to address some of your concerns, which I know we will address here in a moment or two. So think about the impact just beyond the employment and the economic harm that you're experiencing and our nurse anesthesia workforce is experiencing right now. We are heavily engaged in advocacy activity in Washington, D.C. and at the state level. Now, first and foremost, as you know, there is still 6 weeks into this crisis, an insufficient supply of personal protective equipment for clinicians, which is frankly appalling. So we are working as aggressively as we can with Congress and with HHS and FEMA and other administrative officials to address it, to rectify this as soon as possible. I can tell you that the workforce, the CRNA workforce, is still experiencing significant issues with an insufficient supply of PPE, and I'll give you an example. Recently, late last week, I had a conversation with a nurse anesthetist in a community hospital, and she has been using the same N95 mask for a month, and she's carrying it around in a brown paper bag. And as you know, those things are manufactured to be single use. And the fact that she's using the same mask over and over again, I think is an indication of the situation that we're in this country. So that's one thing that we're aggressively working on from an advocacy perspective. The second thing we're looking at is providing additional financial protections for nurse anesthetists and nurse anesthesia students. As you undoubtedly know, the CARES Act 1.0 and then the supplemental funding after that has done very little to address the economic harm our members are facing right now. And we continue to work as aggressively as we can with our colleagues or our allies in Congress to address that through a potential CARES Act 2.0, which is under development, but its outcome is not yet clear. Beyond that, we're working on securing financial protections for students, particularly as it relates to loan repayment. We know for the CRNAs and the students who are working now with COVID-19 patients, we think because they're exposing themselves in many cases with insufficient protection, they should receive hazardous duty pay. And I strongly feel that way. And what I've been saying in the last 2 weeks is, when I was deployed to Afghanistan, I was provided the training and the equipment I needed to protect myself. And what we're seeing now is we're asking healthcare workers to take care of patients, expose themselves, and indirectly, unfortunately, expose their families to a very dangerous disease. So we feel strongly that folks who are stepping up should be compensated appropriately. Another thing that we're addressing is and I mentioned this when I first started speaking, is this interesting situation that we're in where we have a significant number of CRNAs who are redeployed in ICUs in this country, taking care of patients, intubating them, managing them, their ventilators, putting invasive lines on, titrating drips, on prone positioning teams. And we've been putting forth clinical resources, including job descriptions and other position statements, to ensure that when they are asked to participate in the care of these patients, they have the resources they need and they have the support they need from their professional association. So we continue to do that. Clearly, the work that we're doing, when I say we, I mean the profession, is admirable. And I hope that you have noticed in the last few weeks the work that our public relations team has been doing to highlight your contributions. I can't go anywhere on social media without seeing CRNAs in the trenches taking care of patients and students. And we've been profiling students as well. And some of you have stepped up and moved back into the critical care environment to take care of patients. Some of you are training other healthcare professionals on how to use anesthesia machines in the ICU, which I'm sure is an interesting conversation with a respiratory therapist. But I want to thank you on behalf of the association for stepping up. We know that facing the uncertainty that you're facing in terms of when you're going to resume your clinical activities and how that will impact your graduation and when you'll be able to move into the workforce, I know must be very difficult. And please know that we're cognizant of that. So moving forward, what should you expect? So this is what I think is going to happen, and I've been wrong before, but what I think is going to happen is you're going to start to see a trickle of elective procedures in this country. We're already seeing it here in Illinois, in that the governor has put forth some guidelines to open up elective surgeries. And as you know, that Chicago, just right down the street here, is a hotspot for COVID-19. So we expect to see a slow but a consistent increase in the amount of elective surgeries, and that's good for you. That means that's an opportunity for you to get back into the clinical environment if you've been displaced. What we're not going to see is someone flip the light switch on and all of a sudden we're at pre-COVID levels of clinical activity in this country. That's not going to happen. So we have to resign ourselves to the fact that this is going to be a problem we'll be dealing with for some period of time. I'll also say it is quite likely, and we are now in a controlled experiment in which some states, particularly in the Southeast, are opening up, and they're opening up quickly. We're going to find out pretty soon what that means in terms of potential second phases of surges in the country and how that will impact healthcare and healthcare providers. So still at this point in time, there's a lot of uncertainty and ambiguity. We know that this is going to be something we'll be dealing with, I think, until for probably at least another year and maybe even beyond. So let's all resign ourselves to that fact. So one plug. So I'm speaking on, on May 2nd. This is pretty cool because the California Association of Nurse Anesthetists has their spring meeting, which obviously was supposed to be an in-person meeting, but that's not going to happen. And they have an amazing lineup of speakers. And the reason why I'm plugging it is because they're providing free registration to all SRNAs. So May 2nd from 8:30 to 5:30 p.m. if you're available, come check it out. And like I said, it's free to all students, and kudos to California for doing that. I think that's awesome. So that's all I have for now. Thank you for your time, and I'm going to send it back to Adriana, I believe.
Fantastic. Thank you, Dr. Moore. I'd also like to thank all the students who have submitted questions for tonight. The ANA staff and panelists vetted the questions to identify the two most common ones pertaining to their area. And we are going to start off with Adrian Chavez, who's the student representative on the Health and Wellness Committee. So the first question for Adrian is, how can I handle the financial stress I'm experiencing?
Thanks, Adriana. So many of us are facing some sort of financial stress at the moment. The AANA recently sent out an email regarding information on how the CARES Act can help CRNAs and SRNAs. I suggest reading that email and making a financial plan with any information you have found useful. If you still have questions, please go to aana.com/COVID-wellness, and you'll find a great article from the American Psychological Association called Managing Your Student Loans During COVID-19 under Students and Coping. Setting up a financial plan can help us tackle the stress we're feeling as it reduces the unknown variables. Reach out to your fellow SRNAs. Many of us are on the same boat, and not only may you find some creative solutions to your problems, but discussing your situation can be therapeutic for the both of you.
Thank you. The second question is, I'm feeling overwhelmed and anxious. What are some resources I can use to help me through these times?
Thank you. First of all, I'm so sorry about the way anyone's feeling, and please know what you're feeling is completely normal. Many of us are feeling anxious with all the uncertainties surrounding us. aana.com/COVID-wellness has great resources, particularly under Students and Coping. I hope you all spend some time sifting through the site because it's truly invaluable during this time. If I had to choose my top 3 favorite resources listed on the website, I would choose Headspace, Support the Front, and the Fitbit free trial. If you go to the website, you'll find a link to the Headspace app that's giving healthcare professionals free premium access through 2020. The app has tons of meditation courses to choose from, including meditation for beginners and reframing stress and relaxing. Meditation can help us reduce stress, control anxiety, and enhance our self-awareness. On the COVID Wellness site, you'll also find information on Support the Front right underneath the CRNA produced wellness content. The AANA has partnered up with Parkdale Center to create free virtual support groups and resources for healthcare professionals. These groups are moderated by a healthcare peer and allow you to share stories and de-stress. This is a great resource for those dealing with trauma, stress, burnout, and post-traumatic stress disorder from the pandemic. Finally, the Fitbit app is offering a 90-day free trial, which has 150 plus workouts from fitness brands like Bar3, Daily Burn, Pop Sugar, and Yoga Studio. If you don't have a Fitbit, there are tons of at-home or outdoor workouts on YouTube and Instagram. You can find free or discounted exercises under physical well-being at the COVID wellness site if you need guidance. Exercising is a great way to relieve anxiety and can help reduce mental fatigue, reduce stress, and help fight depression and anxiety. Remember, you're not alone in this fight. The AANA has your back. Keep checking aana.com/COVID wellness for new content and resources.
Thanks so much, Adrienne. And I loved your recent podcasts on health and wellness. And I'm going to try to incorporate more meditation into my daily practice. Next, we're going to hear from Reagan McCammon from the Practice Committee. His first question is, due to the uncertainty regarding when we will go back to clinical, would you recommend that SRNAs look for flexible ICU RN positions during this time?
Hey, Adriana, thank you for having me. This is a really good thing you're doing here. So first of all, with this question, I just want to say up front, the AANA does not have a formal recommendation for whether or not SRNA should seek out RN positions during this pandemic. This is a very important decision. It needs to be made on a case-by-case basis with discussion between you and your own program director. But in light of that, I did want to provide some considerations you should take into account if you are considering employment as an RN. So first of all, what does your program recommend? And you really need to think about how might this decision impact the completion of your anesthesia program. Just don't forget that you started anesthesia school with the goal of completing it and becoming a CRNA. So just make sure, is this decision going to affect that goal? Next, you do need to consider what if you are exposed to a COVID-19 positive patient and self-quarantine is required, but then your school decides to resume clinical rotations. How many additional days of clinical will be missed? Will your exposure increase the risk of exposure in your own patients at clinicals? Some other things to consider, what if you actually get sick and are unable to return to clinical for an extended period of time? Will you be able to keep up with online classes and scholarly project requirements while you're working as an ICU-RN? Will the financial benefits of working for a few weeks really make a difference for your financial stability in the long term? If you are considering getting a job and you're considering traveling for RN assignments, think about the fact, will you be able to return home? What if those travel restrictions in the area you go to are increased? And then are you aware of how COVID has spread within that community you're thinking about traveling to? Something about contracts. Are you thinking about signing a contract you may not be able to get out of when clinical rotations resume? What might that mean for completing program requirements? And then lastly, if you do consider getting a job, just don't forget that you're working as an RN and you must obey the scope of practice as an RN. So I would assume a lot of you are considering working RN positions in your previous nursing units or in current clinical sites where colleagues know you. They know you're in anesthesia school. So just be very careful about performing SRNA duties while in a role as an RN. And just if you haven't heard it, I'll echo what Adrienne said. A great resource for SRNAs is a podcast from the Head of the Bed with John Lawrence. If you're not familiar with that, definitely check it out. In 2 recent episodes, he discusses how CRNAs have been directly affected by the COVID crisis. He spoke with the immediate, past, and the current SRNA rep on the AANA Health and Wellness Committee, the current rep you just met, Adrienne Chavez, and they discussed SRNA resources during this time and considerations of seeking work as an RN. If you haven't, please also visit the AANA Wellness resources for SRNA wellness during the COVID pandemic. There's a lot of resources there to help SRNAs cope with stress and uncertainty, like Adrienne said as well.
Great recommendations. Thank you. The second question is, if you are scheduled to return to clinical starting today, should you be wearing an N95 during the clinical shift if you are intubating and doing MAC cases?
Yes, this is a great question. So the short answer to this question is yes. SRNAs in clinical sites should wear N95 masks during their clinical shifts if they're intubating or doing MAC cases. As you may know, the AANA and the ASA issued a joint statement on the use of PPE during the COVID-19 pandemic, which states that all anesthesia personnel should utilize PPE appropriate for aerosol generating procedures for all patients when working near the airway. So PPE appropriate for aerosol generating procedures is defined as an N95 mask or a PAPR for those unable to wear N95s, eye protection in the form of goggles or a disposable face shield that covers the front and sides of the face, a gown, and gloves. For MAC cases specifically, the AANA states that if dispersion of potentially contaminated exhaled gases from an open airway is a risk, you should consider alternate anesthesia plans. They go on to say non-airway MAC cases with spontaneous ventilation may be acceptable if fresh gas flows are low, but you do need to consider the anesthesia provider's proximity for jaw lifts or the potential for intermittent positive pressure ventilation if brief apnea occurs. Therefore, PPE for aerosol generating procedures should be worn. Airway cases such as upper endoscopies, bronchoscopies, and any situations that induce cough or sneeze should be considered high risk for aerosol production. Another consideration is that if a failed MAC case may need to be transitioned rapidly to a tracheal intubation, and this likely bears higher risk for suboptimal conditions. According to ASA recommendations, experts are reporting that natural airway MAC anesthesia is not being used in areas of high COVID-19 community prevalence, but instead they're doing planned controlled endotracheal anesthetics. So just want to reiterate, in areas with higher community spread or prevalence, expert opinion discourages LMAs, MAC, and regional cases that have a high risk for conversion to general anesthesia. I just want to touch real briefly on LMAs. So in terms of the use of LMAs, the AANA states on their FAQ page that expert opinion suggests LMA use may carry greater risk of generating aerosols when compared to tracheal intubation. While an LMA usually seals the airway at low pressures, there's concern that higher positive pressure, if used, may create a leak with aerosol production. They go on to say that LMAs may be an acceptable option with select patients because of a decreased risk of coughing. And I just want to say, please note this information includes the current recommendations, and these recommendations may be evolving. So please continue to monitor the CDC, the AANA web pages for updated recommendations, particularly as elective, non-emergency surgeries start to resume in the States. And in addition, keep informed on the spread of COVID in your own community so you can be best prepared. And that's it.
Super thorough. Thank you so much, Reagan.
Yes, you're welcome.
All right. Now we're going to hear from Emily Dong on the Government Relations Committee. Emily's first question is, with the closure of testing facilities due to COVID-19, do you think that new graduates practicing as CRNAs may become a reality again? And pardon me, as graduate RNAs.
Yeah, thank you, Adriana, for having me here. Well, first of all, I want to say as a junior who's already overwhelmed when thinking about all the concepts I've already forgotten, I empathize with the countless hours you must have spent studying for an exam you can't take right now. So for those of you who are unfamiliar with the concept of GRNAs, it is a title given to new graduates of an accredited nurse anesthesia program who are clinically practicing but have not either sat for boards or are waiting for test results. So usually these people are given temporary permits to practice because they're waiting to sit for boards or waiting for test results. And yes, you're right. COVID-19 has led to testing site closures, and currently new graduates have to wait to sit for boards and become certified. So we're wondering if we can get our career started during the interim. Before COVID-19, 29 states have already put together explicit graduate provisions with guidelines to allow GRNAs to practice before getting certified. So that's good news. Unfortunately, that means 21 states have not outlined new graduate provisions, and therefore you need to become certified before you can practice. Now, with the current COVID-19 pandemic, some of these 21 states without new graduate provisions have relaxed their licensure requirements to allow GRNAs to practice as well. And more specific information on a state-by-state basis can be found on the AANA website under the Advocacy and Policy tab and the State Government Affairs subtab. So I hope that helps.
Thank you, Emily. Question number 2 is, with the devastating effects of COVID-19 and the magnanimous response from CRNAs as a whole, will this aid in nurse anesthetists becoming officially recognized as APRNs and increase the number of opt-out states?
Yeah, so I'm very proud to be a part of this profession because CRNAs have been stepping up all across the nation in response to COVID-19. And as a student, it is inspiring to see that we've made strides in promoting our profession. And I'm excited to continue that trend. So to start, CMS has waived supervision requirements for CRNAs during this pandemic, allowing CRNAs to function to the fullest extent of their licensure and leaving supervision at the discretion of the hospital and state law. So in regards to state law, state associations across the nation are continuing to advocate for removal of restrictions. Sorry about that. Yeah, and governors are recognizing the importance of our role in healthcare. So for example, Arizona became the 18th state to opt out from the federal supervision requirement as of March of 2020. And 11 states that are currently not opted out have either temporarily removed supervision restrictions or increased in some capacity CRNA's ability to practice to their full scope. And because we want to continue practicing to our full scope after the pandemic, state associations are working with AANA and the Government Relations Committee on strategies to make these changes permanent in regards to practicing to their full scope. In regards to the APRN status, 44 states and the District of Columbia recognize CRNAs to be advanced practice nurses. And more information on all of this can also be found under the State Government Affairs subtab. Thanks, Adriana.
Awesome. Lots of great work happening right now. I want to take a moment to address the next question. The question is there anything that the AANA is doing to help SRNAs who are experiencing financial hardships during the COVID-19 crisis? And of course, there are many things. The AANA is committed to supporting students during this pandemic and is aware that some may experience financial crisis. The AANA Foundation offers emergency assistance to SRNAs who need emergency financial support through the Student Emergency Educational Scholarship Program. The Student Emergency Educational Scholarship, SEES Fund, is a need-based scholarship that is intended to support nurse anesthetists during times of crisis and natural disaster and can provide one-time assistance to SRNAs up to $5,000 depending on the applicant's individual need. For more information, please visit the AANA Foundation webpage on the AANA's main website. In addition, the AANA has also partnered with Laurel Road, which is a leading student loan company, to offer a webinar on the federal response to student loans during the COVID-19 crisis. Topics that will be covered include updates on the CARES Act, federal financial aid considerations during the COVID pandemic, who qualifies for public service loan forgiveness, and issues around refinancing student loans. The webinar is this Wednesday at 12 p.m. Central Time, and you can register for it on the AANA webpage by visiting the upcoming AANA webinars and events page found on the AANA's main COVID site. Next, we are going to hear from Dr. Bonanno from the COA. The first question for Dr. Bonanno is, what is the COA doing to address nurse anesthesia students' concerns about their ability to meet the minimum clinical experiences requirements with limited access to clinical sites?
I thank you, Adriana, and it's a hard act to follow. You students, y'all have done a great job. So I just wanted to begin with expressing my appreciation for the opportunity to provide some information on what the COA is doing in response to the COVID-19 pandemic and to address some of the questions that are common. I recognize the impact that COVID-19 has had on each of you as students personally, as well as in your didactic and clinical education, and that because of this pandemic, many of you are now learning remotely and have been displaced from clinical sites. So as a nurse anesthesia program administrator at LSU in New Orleans and as president of the COA, I can attest to the important role that you as students play in the nurse anesthesia community. And in my particular program, I have over 125 students enrolled. So we're feeling it there as well. And for those of you who have been providing care to patients during this crisis, I want to thank you for doing that as well. So before I go directly into the question, I just wanted to provide some background on the Council on Accreditation that you as students may not be aware, kind of what our role is and what we do. So there are currently 124 accredited nurse anesthesia programs and approximately 7,000 students enrolled, with over 2,000 clinical sites located across the United States and in Puerto Rico. And the COA's primary purpose is to ensure that these programs provide high quality educational opportunities for nurse anesthesia students. We have 13 members on the COA, which are representative of the community of interest. So on the council, we have nurse anesthesia educators, we have practitioners, we have a healthcare administrator, a university representative, public members, and we also have a nurse anesthesia student. And the Council on Accreditation works with the AANA, the NBCRNA, and the Foundation for the overall good of the nurse anesthesia profession. And we do this through our standards and through the quality assessment and improvement accreditation processes. So our processes have to be consistent with the United States Department of Education and the Council on Higher Education Accreditation, and also legal requirements. And our standards include requirements for clinical experiences, which reflect what the nurse anesthesia community of interest has identified as the minimum requirements for program completion and entry into practice for safe, confident anesthesia providers. And more recently, the COA has been considering the recommendations from the full scope of practice competency task force, which includes an increase in certain clinical experiences, as well as the addition of clinical experiences to ensure that graduates are prepared to practice in an independent setting. So the question was related to what the COA is doing to address student concerns regarding their ability to meet clinical experiences with limited access to clinical sites. And I can tell you that the council has been very busy. We have been monitoring the impact on programs and students, which includes surveying programs, and then tracking inquiries or questions and concerns that are submitted to the COA, as well as responding to those concerns. We're carefully assessing options for other methods for students to meet certain requirements for clinical experiences. And this included us doing a review of the literature and reviewing some of the actions that have been taken by other accreditors, as well as looking at the USDE and CHIA requirements. The COA Executive Committee meets weekly, and that includes myself as president, the vice president, and the secretary treasurer. And the full board has been meeting every other week. Obviously, we've been meeting virtually. The accreditation staff have been responding to inquiries on a daily basis, and then they've been collecting and monitoring that data. And then the CEO of the COA, Dr. Jabasi, and I are in daily communication. So we've been making informed decisions related to programs and students' concerns, at the same time ensuring that the standards and the requirements support graduates, and that 2020 graduates are prepared with the knowledge, skills, and abilities for full scope of practice in all types of settings. So as a result, the COA has approved alternative method for spring graduates to meet certain clinical experience requirements. We have streamlined the process for programs to implement distance education. We've expedited the process for review of new clinical sites, and we provided frequently asked questions to give clarification on accreditation requirements. And we've conveyed these decisions and notices to programs, and we've also posted these on the COA's website, which is coacrna.org. And we also recognize that because of the pandemic, graduation for some students may be delayed. And we are going to continue to monitor and evaluate the impact of the COVID-19 pandemic and do as much as we can to support programs and students without jeopardizing the accreditation standards.
Thank you so much. You're doing a tremendous amount of work to support us. The second question is, will the Council on Accreditation apply the alternative method for meeting the minimum clinical experiences requirements to students scheduled to complete their programs this summer, July through September, and the fall, October through December?
So yes, we're going to continue our monitoring activities, and we're going to begin with data collection, which includes a survey that's going to be sent to all programs this week to assess current access to clinical sites, as well as the expectation for access to clinical sites moving forward, as we're starting to see some states removing some of the restrictions regarding elective surgery. And we're going to continue to track questions and concerns and provide responses as those come in, and we'll make informed decisions. So in regard to the alternative method being applied to students with summer and fall 2020 completion dates, we have not made a decision at this time. The situation is obviously fluid and the restrictions are changing on a daily basis, but we will be sending a survey to programs with summer 2020 and fall 2020 completion dates in a couple of weeks, and we're going to assess the status of graduating students in meeting clinical experiences requirements, and then the results of that survey will be used by the COA to make an informed decision. So we're going to ask that students continue to communicate with their program administrator on the status of returning to clinical sites, because policies and processes are going to vary by program as well as university. And we, as a program administrator, I can tell you that the education and clinical training of students is the top priority. So if you have questions or concerns about the accreditation requirements that your program administrator cannot answer, we ask that you please contact the COA. And the best method to do that is to go to our website, coacrna.org. And on the website is a Contact Us tab that you can click on, and the staff will then follow up with you if you provide your contact information to us. So I just want to say that you can rest assured that the COA values you and that we are very concerned about the challenges that students are experiencing in continuing their education given the COVID-19 restrictions. We're going to continue monitoring and assessing activities to inform our decision-making while ensuring the public that graduates of nurse anesthesia programs meet the minimum requirements for entry into practice for safe, confident anesthesia providers.
Thank you so much, Dr. Banana.
Thank you.
Finally, we will have Dr. Preston from the NBCRNA. Dr. Preston's first question is, will the NBCRNA consider temporarily modifying its requirement to sit for the NCE to allow senior students to take the exam prior to completing the minimal clinical requirements they may have left?
Well, first, I want to say thank you, everybody, for attending this evening, and that it's a pleasure to be here and be here with my colleagues. And that's a really important question. I know that probably every single student that's close to graduation is asking some form of that question. So I think it's also important to know that the NBCRNA enforces what the COA sets, because what we require as an eligibility qualification to test and then to become a nurse anesthetist is that applicants be a graduate from a COA accredited nurse anesthesia educational program. And those minimums are what are required by the COA for successful program completion. So that's not, the changing the minimums is not up to the NBCRNA.
Thank you so much. The second question is, for students completing their programs in the next week, Pearson testing centers are predicting the earliest test dates are now in July, 2.5 months out. What, if anything, is being done by the NBCRNA to address this issue? Are they going to expand testing center capabilities, investigate alternative testing center options, etc.?
Well, without question, this is the most requested question in one form or another of the NBCRNA, and it's for obvious and very important reasons people ask this question. So, even before the current national health crisis, the NBCRNA had weekly meetings with Pearson VUE, our vendor, going over any incident reports that took place, the process for all of our individuals to register for testing, all of the functionality of the Pearson systems. So that was a routine contact that we had with them. During the past 6 weeks, we've had certainly increased interactions. They have been sometimes multiple times in a single day with the leadership of Pearson. And that really has included extensive discussions about how to get testing available to graduates and how to make those testing centers hours and abilities for individuals to take the examination, to make it available. So I do think it's important to note that we have had the NCE back up and available since April 7th. And the SEE came back online recently, and we announced that today to educational program directors. So they received a notice saying that individuals could begin to register for the SEE. Backing that up just a little bit and looking at what's happening with other advanced practice nursing certifiers across the nation, in comparison to our other colleagues, the NBCRNA was able to restore testing opportunities to our candidates earlier. We have negotiated for more testing opportunities for our graduates. and we have been able to secure more seats for our candidates than any other APRN certifier. But that doesn't mean that that's necessarily enough. It just means volume-wise, we've worked very hard to get the seats and the opportunities that are out there right now. And we're continuing to work to increase that volume. It is important to note that many times that is not only regulated by Pearson, it's regulated by local municipalities and regulations that they may impose upon the testing centers and or state governments who may not view that activity as essential. So, there are many layers to that onion getting to the opportunity for an individual to register and take an examination. And so we also have to acknowledge that it is beyond our control or any test vendor, Pearson or any other test vendor, to overcome those local restrictions or governmental restrictions. We certainly work and advocate to try to get around when it's safe, but certainly safety is an incredibly important aspect of all this. So we wouldn't want individuals to be unsafe in trying to achieve testing opportunities. So until the crisis resolves and returns to a pre-COVID state, there will continue to be geographic maldistribution of testing site locations. One thing that we did early in this situation was we opened up additional, what's called a third-party channel for Pearson. And there really are three types of Pearson testing centers. There are the Pearson testing centers that are owned and operated by Pearson. There are the Pearson testing centers that are based, I'm gonna call them franchise. That's not the right term, but they work on a basis somewhat like a franchise. They're not owned by Pearson, but they look like a Pearson center. They follow all the Pearson rules and regs, and they're labeled and branded like a Pearson center. And then there's a third set, and they're perfectly fine. They meet the Pearson standard. They have all the technology that any of the other Pearson sites may have, but they're not owned or operated by Pearson. They are operated by contract with Pearson. And those may not be labeled Pearson at all. They could be computer labs at local universities, or they could be Horizon testing centers, which are not a typical location where an individual would go to take an NCE or a C. But we did add those back to the chain, opening about 1,200 potential sites. Once again, the actuality is if the local government has restrictions or the state government has restrictions, then those businesses, if they can't overcome that, then they're going to be closed. But we have worked very hard to try to see that as many possibilities were out there and available to our graduates and to our students now to take both the NCE and the SEE. And some good news here, okay? Once again, I don't have an official notice from Pearson, but in our communications with Pearson, we believe that probably at the end of this week or the beginning of next week, Pearson will open up even more sites, making more testing seat opportunities available to our graduates. And it is possible that they may open all of their testing sites unless that site is restricted by local or state governmental regulation. So that would be a considerable increase in the number of opportunities that would be available to any of our graduates. All along, to accompany all of this is the requirement that social distancing be observed. So that will reduce the capacity while they'll be opening up many more sites, and they won't have everyone back in the fold. Okay, it'll still only be those individuals that are considered essential, and they have to meet the requirement for essential. There is a reduced number of individuals at any one time to maintain that 6-foot minimum social distancing that's required. But the net result of all of that means there will be more opportunities for individuals. I would also caution, there's also what I have called atrial fib of certification. It's irregular. And these testing centers may close without notice or very short notice, requiring that individuals be rescheduled. Sometimes multiple times they have to be rescheduled. And I understand That's incredibly frustrating and frightening and concerning. And I admit that. And if it was in my power to stop that from happening, I would never let that happen. But that seems to kind of be the times that we're living in now. Things that used to be relatively certain no longer necessarily are certain. So we have to have some flexibility. If an individual experiences a cancellation of an appointment, please go back as quickly as possible and try to secure another appointment. Lots of times what they're doing is they're purging out appointments for centers that have closed, and the individual simply doesn't know that it's a future appointment. And if that center closes, they want to close out that appointment, and then they want the individual to come back. They may reschedule for you, but if they don't reschedule the appointment, please do so as quickly as possible. And also, unless for some reason you don't need the examination anymore, for example, you were registered to take a C exam, but now you're going to actually complete your program before you can take the C exam. Except for cases like that, I would advise you don't cancel your appointment. If you cancel your appointment, you wind up at the back of the line, and we wouldn't want that. Keep your appointment and then work towards changing the appointment depending on the dates that may become available to you either at the Pearson Testing Center or dates that may become available to you because your program is able to let you complete earlier than you anticipated. And just one thing, the July date, the earliest test dates, that was part of the question, saying that July was the first opportunity. That's not correct. We do have individuals right now. As I said, I check every single day to see who has registered. And what I was seeing in the beginning, soon after this April 7th, when we restored testing, I would see individuals get registered and then almost all of them would get canceled. That's really turned around. The last week, we've had maybe 1 or 2 individuals being canceled for NCE and 30 or 40 being registered to take NCE. Now, numbers are going to increase. Springtime is a busy time for graduation, but coupled with that should be increased capacity, increased numbers of test sites, probably some increased frustration, but just keep with it. And I feel pretty confident that individuals will be able to get a testing location. It may require that you travel to an alternate location. It may be further than you anticipated, or you may wind up at one of the third party channel sites that may not look like a Pearson testing center, but if you are registering for that site through the Pearson site, you can be assured that your examination will be delivered just as it would be in any Pearson branded site.
Thank you so much, Dr. Preston. Appreciate your time. Thank you so much to all of our panelists and our SRNAs and our student reps for attending this town hall. We hope you found all this information helpful, and just know that we're here to support you. Quick reminder that applications for student representative to the Education Committee are due by May 4th, and applications for AANA committees have been extended to June 30th. Being a student representative on the AANA committee is a great way to get involved in our professional association, and I highly encourage you to apply. To say that I've enjoyed my experience would be a total understatement. You can find more information about these roles on the AANA website, and I'm happy to answer any of your questions alongside all of our other fantastic student representatives through the AANA Connect or through the @StudentRepSilva Instagram account, which will be passed on to the next student rep. Good night, everybody, and stay safe.